Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Earl Stewart Jr. He's an internal medicine physician. Today's KevinMD article is titled, EHRs Must Do More to Help Combat Climate Change. Earl, welcome to the show.
Thanks so much, Kevin, for having me. It's a delight to be here.
We'll get into the article in a little bit. First off, briefly share your story and journey to where you are today.
Yeah, so I'm originally from Augusta, Georgia. Georgia boy, born and raised. I did my undergraduate studies at Mercer University in Macon, Georgia, med school at Meharry Medical College in Nashville, Tennessee, and residency at Brown University. And I've been practicing in various capacities in the state of Georgia since 2016, since finishing residency. I'll now serve as a primary care physician in Atlanta with the gargantuan WellStar health system, and have other roles, including serving as a health equity fellow with the Medical Society Consortium on Climate and Health, funded by the American College of Physicians as well as NMA, and serve as also founding president and CEO of our family foundation, my namesake, Dr. Earl Stewart Jr. Family Foundation. But I'm very passionate today to meet with you to talk about the climate crisis and how EHRs can definitely do more to support us as physicians working in this vein of practice.
So, like you, I also do internal medicine, primary care, and we read so many things about physicians burning out and all the challenges that we face as primary care physicians. So, let me ask you, what keeps you going in primary care?
My faith, the love and support of a wonderful network of friends, many of whom are physicians, many of whom are not, and just staying grounded. And what keeps me grounded is tapping into the other part of my brain outside of science, technology, and mathematics, and medicine and health sciences. I love to garden. I love to travel. I love to just spend time with my family. I adore the beach. I read, I write, and in another life, really, I'm a published poet, sing, I'm a pianist. And so I try to, even in my day-to-day practice of medicine, bring my whole self to work in taking care of my patients. And it makes me take a humanistic approach to the delivery of healthcare every day. So I would say that's what really keeps me focused and helps to keep me away from getting burnout, which as a human being is possible.
How did you get interested in that intersection between climate change and medicine?
I know that I have always wanted to learn more about climate change. I know that I've always wanted to know more about how climate impacts health. And unfortunately, much of that education does not come through traditional medical academia. I mean, you don't really get that training in medical school
Mhm.
and none in residency. However, your patients are encumbered with the ravages of climate change. And so I was approached by leadership of the American College of Physicians to potentially accept this opportunity. And unbeknownst to me, many of my friends and colleagues and former, medical school classmates, a few of them have already done it, and even fellow physicians I work with here through the ACP in Georgia. And I reached out to them and I pretty much said, well, how did you like this? And then they were very candid. They say, it's very intensive, but you will learn and you will make a tremendous impact. And since the inception of this year's cohort, we've really hit the ground running and tackling issues from air pollution to the need for electric school buses to decarbonize the environment, the need for mental health focus in terms of how climate impacts mental health, things like severe thunderstorms and severe weather of various types, how it causes anxiety, can even be linked to, I've learned since this fellowship started, that asthma exacerbations have a tendency to increase when severe thunderstorms happen and are even threatened. So, more so in terms of how health equity is impacted and health inequities are impacted by climate change. That's where this fellowship really gets us as physicians of color involved in basically offering a clarion call that we need to do better as a society, as a healthcare sector, but as also as individual physicians and being on the front line to to talk about how this impacts our communities and our patients that we serve.
All right, let's talk more about this topic in your KevinMD article. It's titled
Mhm.
EHRs Must Do More to Help Combat Climate Change. Now, how did your article come together?
My article came together by a lot of input from the Climate Health and Equity Fellowship leaders, Dr. Malcolm Mitchell, Dr. Kimberly Williams, Dr. Venice Curry, in terms of giving me guidance in terms of what I wanted my capstone project to be. But also their tutelage has been great because it's allowed each individual fellow there, I believe there are 13 of us this year,
Mm,
who are doing this work. It allowed each individual fellow to really take an individualistic approach to how we want these projects to take shape. And I have always been remarkably passionate about patient education.
mm,
I feel like we can sit in the office every day and pontificate to patients about what they need to do and shake our long religious finger at them about changing how they eat, but unless you give the patient education and give them the opportunity to ask you questions and you teach them, doctor from the original Latin term means teacher.
yeah.
So we're supposed to teach our patients. And so this project took shape by meeting with the fellowship leaders, doing a literature search, looking and delving into my own health system's electronic medical record system, Epic, which is one of the foremost, if not the
Mhm,
most foremost, electronic medical record system that we use in the United States, and seeing what was there. And I did not see much on climate change. There was a little bit there about asthma and environmental allergens in terms of how they're impacted by air pollution and how those conditions can develop and be exacerbated by those types of conditions. But it was very slim pickings. And so I said that this needs to change because, especially at the point of care, being able to add patient education documents about how vulnerable populations are disproportionately impacted by the ravages of
mm,
climate change, how Black, Indigenous people of color are impacted by the ravages of climate change, even about the incentives that exist from the government through various acts and legislation, such as the Infrastructure Act, the Inflation Reduction Act, the Infrastructure and Investment in Jobs Act, passed recently by the Biden administration. These are all acts that provided for incentives individually and as communities and organizations to create greener environments, more sustainable agriculture, incentives for solarizing one's home,
mm,
incentives for creating green space, incentives for purchasing and maintaining electric vehicles. And so I feel like, honestly, that the vast majority of the American populace just does not know about this. And we as physicians, really physicians of color who are taking care of these communities who are disproportionately impacted by the climate crisis, we are the ones that they trust.
yep,
They trust their family, they trust their neighbors, they trust their church members, first and foremost, usually, but they trust us a great deal. And especially if we can empathize with them and understand their plight, because we as physicians of color may also have similar backgrounds.
mhm,
And I say that to say, I since I've been doing this fellowship, since I've been learning a great deal intensively about how climate impacts health, I can tell you, I'm thinking back to, flooding in my own neighborhood. I grew up in the inner city in Augusta, Georgia, how corporations were just right down the street and around the corner, and how we could smell the changes in the air when there was a lot of pollution.
mm,
Driving around now, when I go back to my hometown and I visit my neighborhood, learning more and seeing the ravages of food deserts, what happens when we close a grocery store. I wrote an op-ed in the local Augusta Chronicle newspaper, I think it was in 2018, about how the closure of one grocery store significantly exacerbated an already existent food desert in my own childhood neighborhood.
mhm,
So this project really was based on all of that taken together and it's still ongoing. At this juncture, I've gotten a lot of great input and potential partnerships with Epic at the national level. We're thinking of definitely implementing some of the climate and health education documents into their foundations database. I'm working in my individual health system to have more of a regional and state specific impact to implement some of the and build some of these patient handouts into Epic. And also, we're partnering with other physician groups in Wisconsin and Florida. And everybody has been really, really helpful and encouraging, even fellow physicians who are doing the fellowship with the Medical Society Consortium on Climate and Health. So it's been a great journey to date. And I'm just delighted how this is going to further take shape to impact physicians, but also the patients we serve.
Now, during the course of your day in primary care, just give us some examples and stories of how you incorporate climate change education to your patients, various touch points through the day where you're able to do that. So just give some stories or examples.
Oh, absolutely. I just recently talked to a patient who I've been taking care of for quite some time who all of a sudden has developed a persistent cough. He lives in a highly wooded area, an area that is kind of remote. And the rural communities we know are also disproportionately impacted by the ravages of climate change because sometimes they just don't have the resources. They may not have as much air pollution, but corporations may be in their background and may pollute the water, and they may not necessarily always have sustainable food sources and
Mhm.
access to certain types of healthcare. And so he drives all the way to Atlanta from about 45 minutes away. And we initially thought that the cough may have been, gastroesophageal reflux disease causing a dry cough. And so we talked more, the condition further developed. And, I told him, I said, I think you have new onset asthma. And he provided a little bit more about his environment. And I said, your symptoms are pretty much consistent with that. Nighttime cough, dry cough, occasionally productive of a grayish sputum. He had gone to urgent care and what I think egregiously gave him antibiotics thinking it was community-acquired pneumonia
Mhm.
without doing a chest x-ray. And I said, I don't think that's what it is. I said, let's give you an empiric course of albuterol, send you to have pulmonary function testing, and see how you do. And I pretty much took that opportunity to educate him about how environmental allergens can impact the development of bronchospastic disease and can exacerbate it. And then I've had patients who come in with seasonal allergies, and we talk about how living close to interstates and the
Mhm.
exhaust from cars. A patient of mine, she had just recently bought a townhome here in Atlanta close to I-20, and she said, before I moved here, I didn't have these issues. She said, I'm wondering if I should have bought the townhouse
Mhm.
now that I can, barely breathe sometimes. And so we as physicians see these cases every day. We see these patients, we see our patients who we take care of who are experiencing the ravages of climate change, but we don't really have the education or the knowledge. And that's why these types of training programs, like the Climate Health and Equity Fellowship, are so crucial, especially for physicians of color who are on the front lines taking care of these patients every day, who otherwise would not have access to care. We need to be the greatest advocate for our patients at the policy making level, at the patient care level. We need to have a seat at the table. And one of my favorite quotes by the late great Shirley Chisholm was that if they don't give you a seat at the table, bring a folding chair.
Mhm.
And we definitely need to be in the room where it happens. If you'll pardon the Hamilton reference as well, we definitely need to be in the room where it happens, not just in the examination room, but in the room where policy, and that's why I wrote the op-ed, where policy is important to have more of a systemic change. And I work it in every chance I get to talk about how climate impacts health now. I did not do it before. I'm going to be very honest with you because I didn't know what to say. But now I know. There was always an inkling of, we know about environmental allergens. We know about pollen,
Mhm.
mold, and fungal spores in the atmosphere. We read the articles, we get the emails about how environmental pollutants may fluctuate and how different plant pollens may fluctuate. And specifically here in Georgia in the southeast, there's all kinds of trees and vegetation.
Yeah.
And so you're going to get blankets of pollen every year that make people sick. But that was the extent. But now we know we can talk about other things, such as the need for decarbonization, even in healthcare. We can talk about how it's important to understand particulate matter and exposing our patients to resources such as Air Now tool where they can check the air quality in their own neighborhood and right where they live, something that I share now with my patients all the time. And so they can take the necessary precautions also to keep themselves from having worsening asthma exacerbations and allergic rhinitis symptoms. So I work it in a lot.
Now, tell me, in your ideal world, what would you like to see EHRs do to help promote climate change education? So,
Yeah.
you mentioned Epic. I use Epic as well. So, in your ideal world, how much more work do these EHR systems need to do?
I think they can start by having a conversation with physicians who are devoted to eliminating and stopping the climate crisis in its tracks. And they are interested. We just need to let them know that, hey, we're interested too, and we want to talk about this. And that's what the op ed, which you fortunately accepted to the KevinMD blog, is helping to do. It's already having a tremendous impact because I'm getting contacted about it. But then they also have to be willing to implement,
Hmm.
not just have the conversation, but implement what physicians are saying who have this expertise and definitely being at the table when it's time to affect policy to stop climate change. I would, but we always the journey of 1,000 miles begins with one step. I think the first step definitely is helping us as physicians who are devoted to this work educate our patients better with a variety of different resources. It could just be one handout right now. It may be thousands in the future. And then hopefully at some point, the EHRs will be able to network with each other to share and extrapolate their individual data as well as these handouts and materials throughout other systems that may not use the same EHR. There's really no incentive for them to talk to each other, and that's another conversation about
Yeah.
creating a health information exchange. But I think definitely first things first. So
And my final question, Earl, tell us some of your
yes,
take-home messages that you want to leave with the Kevin MD audience.
yeah, physicians are crucial in this fight. We are our patient's greatest advocate. We have to advocate for our patients, but also for ourselves. We need to become more comfortable having the conversation about how climate is impacting health. And we need to be willing to have a seat at the table and speak truth to power about these issues. And I specifically issue a clarion call to physicians of color, all physicians, definitely, but definitely physicians of color in a variety of different specialties can have a tremendous impact in helping us eliminate the climate crisis and its impact on health.
Earl, thank you so much for sharing your time and insight. Thanks again for coming on the
Sure.
show.
Thank you, Kevin, for having me. It's a delight to be with you.